Thank you so much for inviting me today. I hope you're hearing me well. Good.
Yes.
Okay. Uh, Thanks for your intro. I also had an intro slide. So yeah, I'm an assistant professor from College of Information Sciences and Technology from Penn State. Soon to be an associate professor. Got the tenure news earlier this month. So like, pretty happy about that. I also lead the Well-being and Health Innovation, or the Y Lab, that focuses on kind of building on health technologies. Just to provide a bit more background about my research, my goal is to improve health equity and access. And toward that particular goal, I create digital health systems to address needs of marginalized populations. And my background is in human-computer interaction and data-driven methods. I have previously worked on using passive sensing of behaviors and contexts for data-driven interventions. For example, I have collaborated with DRAR in developing ML systems that specifically focuses on individuals living with schizophrenia. We are also currently working on creating supportive fintech or financial technology for marginalized communities, specifically using open banking API for both objective assessment and data-driven interventions across different stages of bipolar disorder and dementia. So as you can see, our work is highly collaborative and interdisciplinary, and I'll be, again, happy to discuss any of my other projects. So feel free to talk after this presentation or just send me an email. But for today, I will specifically focus on using generative AI for health intervention messages. I'll first talk about the common challenges in health intervention messaging. I'll then discuss the potential of using generative AI to address some of these challenges. I'll also discuss the limitations and potential future research directions in using generative AI in this context. So let me start with um, sorry. Let me start with generative messaging. So messaging is a critical component for any health interventions, and any successful interventions would require figuring out what to say and how to say it. And once we have figured those questions, then these messages can be displayed in different forms. They can be, say, SMS, they can be push notifications, in-app labels, and so on. And any studies focusing on generating health intervention messages needs to address these three key challenges, among others, and I call them trouble. The first one is align. These messages must adhere to a set of predefined strategies and theories. And the second one is adapt. How we are going to adapt these messages to support personalized needs. And the third one is appeal, how to ensure both novelty and sustaining engagement. Let's start with alignment, that is alignment with theory. So health behavior theories are a family of psychological models that helps us to understand and predict health behaviors. And these theories are essential for intervention design because they establish what to target and how to support behavior change. And there has been a large number of health behavior theories in recent time. For example, there are health belief model, social cognitive theory, trans-theoretical model, theory of planned behavior, and so on. However, generating messages following these theories can be quite challenging. First, there are perhaps too many theories. Mishi et al. Identified 83 health behavior theories that comprise more than 1,000 constructs. And very few, like if any individual, can be expected to understand and design interventions for all these constructs. And sometimes these theories are also underspecified in identifying specific behavioral targets, and this can make it much harder to generate concrete intervention messages. Also, a single intervention study might use multiple theories to achieve different behavioral outcomes. So this means often we need to combine multiple behavioral targets and constructs, which makes it quite challenging to generate corresponding messages. And aligning to theories can be particularly challenging for mHealth interventions. As Dror and others have noted, mHealth requires interventions that are consistent with how we interact with our devices. In other words, these interventions should be short and opportunistic. This means there might be multiple messages per day, and adapting existing theories to create these messages that support mHealth specific interactions can also be quite tricky. Now let's move to the second challenge, that is adapt. Intervention messages also must support individuals' needs and preferences to be successful. And this means we need to adapt messages to reflect different variables and factors. These variables and factors might include demographic variables, such as age, gender, as well as specific behavioral targets and goals. And then these messages also should reflect environmental and contextual factors when it comes to personalization. For example, suggesting going out for a run when it is minus 20 degrees out might not be a great idea, right? So when it comes to specifically just-in-time interventions, there are potentially a large number of contextual and environmental variables that can shape our message content. For example, you might want to update your messages based on location, weather, or even phone use patterns. And individuals' needs and preferences are also not static. Like, people change. They go through different habits, different priorities. They move from one motivational stage to another. And what this means is that we must be able to adapt messages over time to better reflect the shifting needs and priorities of our participants. And the third challenge is appeal. Sustaining engagement and adherence has been a key challenge for mHealth applications. Ensuring message relevance and novelty is a key component for sustaining this engagement. And repeating same messages doesn't work. Repeating same messages can lead to both annoyance and boredom, as well as in some cases, content blindness. Furthermore, message repetition can cause purposeful avoidance and in some cases, even reactance. So it is really important to provide novel messages with diverse content instead of just repeating same messages again, and again. So these are the three challenges commonly shared by mHealth intervention approaches. So that is the need for alignment with theory, the need for adapting those messages, and also appeal to sustain engagement. And this makes generating mHealth interventions particularly difficult. It can be both labor intensive and costly to generate these messages, because generating messages while ensuring alignment requires certain types of expertise and time. Also, it is hard to foresee all different personalization needs and relevant contexts. As we have mentioned before, it is particularly difficult given mHealth intervention frequencies, multiple messages per day. So for these messages, it is also important to avoid repetition. And in some cases, multimedia messages, say with images, can help with both engagement and adherence, but it is significantly costlier to generate those multimedia messages. And you can see the difficulties of generating mHealth interventions. Current approaches often rely on a small set of text messages, which can create a serious barrier in intervention efficacy, specifically when it comes to designing longitudinal studies. And I think this is a serious constraint of current approaches, which has limited both the use as well as the efficacy of mHealth systems. So what do we need? In an ideal case, we should be able to create large number of messages that are adapted to individuals and contexts while ensuring alignment with theories and sustaining engagement. The question is, how can generative AI help in this context? So generative AI allows both cost-effective and scalable message generation. But can we use generative AI to address these three key challenges that I mentioned: align, adapt, and appeal? And what are the potentials and challenges in using generative AI to create health messages for us? To make this discussion a bit more concrete, I will focus on two of our ongoing digital health projects. The first one focuses on interventions to promote physical activity, and the second one focuses on supporting individuals in palliative care. Note that both of these are quite early stage projects. So specifically, we are still working on evaluation, message efficacy, and appropriateness. However, we have gone through preliminary message generation steps, and I will discuss insights from our implementation process. All right, let's go ahead with the first project, that is promoting physical activity. Lack of physical activity is a serious public health issue. More than 70% of adults in the United States do not meet the recommended guidelines. So this means designing effective interventions for this broad population is a critical need. And these interventions must also be both personalized and context-specific. We have an ongoing project called Gameplay that focuses on generating messages to promote physical activity. And Gameplay aims to address the three challenges I mentioned earlier: align, adapt, and appeal. It uses theory-informed prompt engineering to support individuals with different health concerns. It also allows personalization and adaptation while focusing on engagement. So let me walk you through these steps. We used the physical activity messaging framework, or PAMF, to guide our content generation. So it is a validated theoretical framework to support the creation and evaluation of physical activity messages. It suggests that messages should include different constructs: who, what, why, and how. And we use these constructs to generate messages in our case. And the second part is adaptation. Gameplay also focuses on adapting these messages to individuals and their needs. For example, we can adapt messages for age, young, middle-aged, or senior, gender identity, as well as health concerns, including diabetes, cardiovascular disease, or cancer. And the third step is appeal. Gameplay also focuses on user engagement explicitly. So we add a hook to make messages more interesting. We can also generate multimedia messages with text-image pairing. And Gameplay uses GPT-4 and DALL-E 3 for message generation. So here are some example messages. For example, quote, "Did you know regular exercise can reduce your need for insulin? Set a goal to hit the gym today. You have got this, buddy." And you can see specific examples of both personalization and hook in this case. We also generate images for different persons and contexts, as you can see here. Now let's talk about the second project, which focuses on interventions to support self-management in palliative care. Individuals with advanced care are living longer, given the improvement in treatment, which is a great news. However, it also means there is an increased need for longitudinal support for both symptom control and emotional management. However, there is a shortage of palliative care specialists. As a result, it is critical to provide self-management support following established palliative care principles. And that includes supporting individuals to make day-to-day decisions, as well as trying to improve their quality of life. And in this project, we are using generative AI to provide messages that focuses on self-management support in palliative care. We use theory-informed prompt engineering. It also allows both personalization and adaptation, as well as focusing on user engagement. Let me walk you through these steps. So this generated message must follow established palliative care principles. We are also using the acceptance and commitment therapy, or ACT, to guide the intervention generation. For message generation, we're using the CONNECT guideline, which is care management by oncology nurses to address supportive care needs. It was designed as a primary palliative care intervention, and it focuses on addressing symptom management needs, including, say, fatigue and pain. It also focuses on emotional support. So here is an example guideline that focuses on fatigue. For example, there is a list of potential options and considerations for individual experiencing moderate to severe fatigue. And this might include, say, activity enhancement steps or even nutrition changes. And the intervention message that we generate must follow these guidelines. And now let's move to the adaptation. We also focus on adapting the messages to individuals and their specific needs. For example, messages must reflect different symptom levels, including how one is experiencing pain, fatigue, or distress. And the third part is appeal. Messages must also focus on emotional and spiritual support for individuals living through advanced cancer. And also these messages must also support empathy. So here is the full prompting pipeline with different variables for self-management in palliative care. And we have been using GPT-4 to implement this generation pipeline. And you can see some of the expected outcomes here. All right, so I have talked about the two ongoing projects and how we are using generative AI for intervention generation in two very different health contexts, physical activity and supporting self-management in palliative care. Now, the question is, like, does it work, right? Can we actually use generative AI for health intervention messaging? What are the strengths and limitations of using generative AI in this particular context? Again, just a reminder that these are preliminary assessments from early stage projects. We do not have efficacy or user evaluation data yet. However, we do have some insights from our implementation process. And overall, I think there are exciting opportunities, but also considerable challenges for using generative AI for health intervention messaging. Let's start with the strength that we noticed. In both projects, we were able to generate messages that aligns with specific theories and constructs. For example, the physical activity motivation messages integrated different concepts from PMF, including who, what, why, and how. And here is an example of how generated messages included PMF constructs. Quote, engaging in regular physical activity can help lower your blood pressure, reducing the strain on your heart and decreasing your risk of cardiovascular disease. How about planning a brisk walk in the park after dinner? And you can see how this message has successfully integrated the different constructs from PMF: who, what, why, and how. It also works well for message generated in the context of palliative care. So these messages included specific ACT constructs, including promoting acceptance without judgment, as well as encouraging commitment to actions that align with their values. We are also able to generate messages that are consistent of existing care guidelines. So here is an example of how generated messages included ACT or acceptance commitment therapy constructs. So this is a message that focuses on fatigue management in palliative care. And it says, hi, it is totally okay to feel tired when you're going through so much. But guess what? Moving around a bit with a walk or some easy exercises might just help you feel a bit better. And remember, it is about being kind to yourself and doing what you can manage. And you can see how it has integrated different ACT constructs, including acknowledgement, promoting acceptance, and also value-based committed action. Just as a reminder, here is the guideline for fatigue that included multiple strategies and considerations, including different activities, as well as nutrition recommendations. And you can see some of these guidelines are quite complex and underspecified. However, even in those cases, we are able to synthesize guidelines to generate highly relevant messages. In short, it is possible to integrate theoretical concepts and constructs for both of these projects. Let's move to ADAPT. We are also able to create highly personalized messages with integrating both individual and contextual factors. For example, we generated messages reflecting different health concerns, age, and gender. We are also able to generate messages reflecting different environmental and contextual factors, including weather and location when we are generating messages for physical activity. So here are two examples of adapted messages. The first is for individuals with diabetes. That is, quote, physical activity can help regulate your blood sugar levels, providing immediate benefits for managing your diabetes. And the second one is for cardiovascular disease. Quote, lower your blood pressure with a brisk walk after dinner, and your heart will thank you. And as you can see, these are highly personalized messages that has been tailored for very specific health contexts for individuals with specific needs. We are also able to integrate content to ensure novelty and support engagement. First, we are able to generate a large number of messages in a very low cost. And these messages also had diverse content. So it is possible to ensure message novelty over time without doing any repetition. We also generated strategies for engagement hooks. For example, the messages include, say, did you know, as a question, starting with a question. Also, make a date with your heart today, go for a jog, and try a yoga session today, namaste to better health, and so on. And some of these might be a little bit cheesy, but I still think is a really useful strategy to get your participants engaged with these messages. We are also able to create and generate context-specific multimedia messages by pairing text and images. So here is an example message. It says, feeling a bit low, a half-hour exercise routine can instantly lift your spirits. Why not set a goal today? And we have generated 3 pairing images with different number of individuals, no people, just a single individual and a group of individuals. And this kind of multimedia messages can potentially improve engagement. So this is certainly a strength of using generative AI. All right. So far, I've talked about the strengths. However, we have also identified several challenges while going through the implementation process. The first one is successful message generation require some filtering and fine-tuning of theoretical constructs and guidelines. So in other words, how can we include these constructs in prompting to ensure successful alignment? And this can be particularly challenging given the black box nature of generative AI. Going back to the fatigue example, you can see there are under-specified and complex recommendations. How can we effectively integrate these recommendations? How can we prompt the generative AI systems to ensure that the generated messages are aligned with this particular set of guidelines? For us, it turned out to be mostly a trial and error process. There is no any systematic methods and approaches yet. And this can pose considerable challenges in ensuring successful theory integration and alignment, because you'll have to kind of just keep trying and figuring out what works and what doesn't work. And there will also be inappropriate and irrelevant messages. Like there is certainly risk of confabulation or hallucination while generating messages. Some messages will be inappropriate and irrelevant to a given context. So For example, I think this particular image is not a good one. The message is want to manage your weight. A short walk with a friend in the park can help. Invite them today, which is a reasonable message. However, the generated image can be an issue if your population, for example, are at high risk of having body image concerns. It can also take things too literally. So in this case, a message about bone health includes a literal bone superimposed on hand, and I don't think that's a good image either. We also came across issues with biased languages. We found that messages might contain some assumptions about aging. There are also messages with gender stereotypes. Here are some example messages that might be considered as biased. A message for a young man says, quote, boost your confidence with a martial arts class, plan a session and unleash your power, be a warrior, not a warrior. And for a message focusing on middle-aged women, on the other hand, talks about looking to manage your diabetes, dear. Regular exercise can help keep your blood sugar levels in check. Try to squeeze in a 30-minute workout today. I don't know if dear here sounds a bit patronizing. We also saw underrepresentation of minority groups while generating images, and this is a known issue for the current version of generative AI models. Overall, we found that image generation is quite tricky. Some generated images might include people, but just a bit off, which can fall into the uncanny valley, for example, having phantom limbs or individuals appearing perhaps too happy in those images. And also some images just don't make sense. For example, I do not know what this tandem bike is going given it has opposite sitting direction. So overall, there are exciting opportunities, but also I noted there are considerable challenges in figuring out how we can use generative AI for health intervention messages. Now, I want to talk a little bit about what are the potential next steps in both addressing these challenges as well as looking forward in terms of future research directions. The first challenge we must focus on is to ensure accuracy and addressing bias while we generate these messages. And I consider this to be a prime use case of why we need human-centered artificial intelligence. In other words, we should focus on augmenting human capabilities rather than aiming to replace ourselves. That is, we should play to the strength of human and machines. So what does generative AI do well in this context, and what are its limitations? AI is great in generating messages in a very low cost, but not great in understanding, say, human values. So we should not directly use AI-generated content. Instead of directly using generated messages, we should bring human in the loop to select and edit generated messages. So it is much easier to edit and filter than actually creating messages. In other words, we should aim for generated by AI and then corrected by humans. So here is an example of augmenting capabilities by integrating human supervision as a key step. In both of our projects, we are not planning to directly use the outcomes from generative AI. Instead, we filter and edit messages following experts and community feedback. So again, generated by AI, then corrected by humans. We keep the humans in the loop to ensure that the messages are appropriate and relevant. In other words, a human-centered approach is essential when it comes to successful generation of intervention messages. So these messages must support specific user needs. They must also support, in often cases, both empathy and inclusivity. and it must include the perspectives of different community members at each stage. Now, there are multiple guidelines and frameworks that focuses on enabling human-centric approach. For example, you might have seen this particular representation. But the key here is ensuring both inclusivity and empathy, iterative and quick implementation so that you can integrate feedback at each step from community members as well as experts. A key next step would also be establishing a robust evidence base of AI-generated message efficacy. Do generated messages differ in efficacy from, say, manually generated ones? Does efficacy and engagement differ if participants know that these messages are generated by AI? And also, what's the impact on therapeutic alliance when we use generative AI messages? So these are some of the critical questions before we can start using generative AI for health intervention messaging. Also, there are questions about engagement and adherence. Say, how does user engagement change when we are able to create highly personalized messages with novel content over a longitudinal period of time? And how does it impact, say, longitudinal engagement and adherence? And answering these questions will have significant impact on our ability to both generate a message and use those messages for health interventions. I'm also very excited about the potential of multilingual intervention creation. Modern LLMs have really strong multilingual capabilities. So here is GPT-4 performance across different languages. And it's frankly really good for languages beyond English. And this provides a unique opportunity for designing interventions for communities across regions and cultures. Specifically, it can potentially be quite impactful for underserved communities, say in South America, Asia, and Africa. But to make this happen, we also need to advance an interdisciplinary research agenda. That is, what are the implementation and deployment challenges when you go for multilingual intervention generation? How does efficacy might vary across different languages and communities? How can we ensure alignment with theory when we generate intervention messages for different regions and cultures? And also, when is it cost effective to design multilingual interventions for different individuals across regions and cultures? All right, so that's what I have. To summarize, I discussed the common challenges in health intervention messaging. I then talked about the potential of using generative AI to address some of these challenges. I discussed two ongoing projects that are using generative AI, including promoting physical activity and supporting self-management in palliative care. I also noted the critical importance of integrating human-centered AI principles to ensure successful generation of these messages. Overall, there are lots of open challenges, but also some exciting opportunities in the ways we can use generative AI in this particular domain, specifically when it comes to multilingual intervention generation across different regions and cultures. So here are my very cool, excellent students and collaborators working on relevant projects. And with that, thank you.